I'm currently serving as the Assistant Secretary General of CIOMR. Prior to this, I was the founding chair of the Junior Medical Reserve Officer Programs, which is an initiative that CIOMR has to try to bring in junior officers and educate them about the NATO programming and what NATO does and its purpose, and to just generate interoperability and relationship building for officers prior to their first engagement in a NATO style environment. By coming to CIOMR, we're exposed to our partner nations in a time of learning and growth. We can build relationships together. We can learn to trust each other and to learn about the models that we're all using so that we can trust that model so that when the American soldier is downrange, we know that we can rely on our partner nations to provide the medical care and the help that we need and be our partner in the fight.
So we have a mix of activities that range from scientific talks and discussions with some of the world's leaders. This week we talked about AI and healthcare, to workshops on planning, and we're also going to have a battlefield study tour focused on large-scale combat operations and lessons that can be learned from World War I.
It is more and more important we can operate interchangeably and interoperably with other allies. And this really is the ground floor for junior officers to get on board and to get that basic understanding, some situational awareness and some experience of dealing with other nations, other cultures and other ways of doing business. I didn't have that opportunity, but I think for the cohorts coming through now, this is an exceptional opportunity which they can then build on going forwards to seek other opportunities, whether it be through exercises, training programs.
I think just like the U.S. Army, the Royal Army has a substantial medical corps and they're heavily represented here. So speaking with their nursing officers, their medical officers, and honestly this has been a great experience for myself. I had anticipated a lot of nurses being here, but instead there are medical service corps, there are a lot of physicians here, a lot of knowledge in operations, which has helped myself personally quite a bit.
It was a pretty easy application process. Part of the application was a military bio, your why to coming to this event, what you expected to learn from it and how it would improve you as an officer and how that would improve your unit and the U.S. Army Reserve. I would definitely encourage all officers in the medical field, and if this applies to other AOCs, to come to this because it has been eye-opening, and I definitely think that anyone would benefit from this.